Hi, I'm Dr. Ashima Gulia, Senior Consultant, Obstetrician and Gynecologist practicing at Cloud9 Hospital, Kailash Colony, New Delhi. Yes, definitely it is possible to have a vaginal delivery after a previous cesarean birth. Such births are called as vaginal birth after cesarean or VBAC. So the patients who want to have a vaginal birth after a previous cesarean delivery would be allowed to undergo a thing called as TOLAC, which is trial of labor after a previous cesarean section. But whether you will successfully achieve a VBAC depends on many factors, many conditions or criteria have to be fulfilled before allowing a patient for TOLAC. Most importantly, we look into the history of the patient. Why was the previous cesarean section performed? Whether the indication for the previous section was a recurring indication or a non-recurring indication. By recurring indication, I mean whether the pelvis of that woman is contracted or a small pelvis which will not allow vaginal birth in any case, so this patient won't be able to achieve a successful VBAC. But if the indication for the previous cesarean was a non-recurrent indication such as a breech presentation or a fetal distress, so these conditions may not come up in this pregnancy, and if this pregnancy goes on fine, so she can have a VBAC. Also, the spacing between the two births, the duration between the two births is very important. If a woman has had her previous delivery within 18 months of the coming delivery, then she would be at high risk for uterine rupture, so she may not be an ideal candidate for trial of labor after a cesarean section. Definitely, rates of success for VBACs are quite high in properly selected candidates.